Good morning, all. So today's topic is interesting, and I'm thankful to Professor Shashank Joshi sir, who had given me this responsibility to deliver this interesting topic, the connection between yoga and PMOS, begin the day in motion. So it is important to note that when you talk about yoga, just like we prescribe drugs in a right manner, it is high time we need to prescribe the right yoga in right manner. So let's discuss this topic with one story of a 24-year-old woman, menstrual cycles every 60 to 90 days, so irregular, along with acne, central adiposity, fatigue, increasing anxiety about fertility, has stopped metformin after watching a social media video. Ask the best pose to cure the cyst. Her question, doctor, which yoga will remove my cyst? What is the first error here? The diagnosis, the expectation, or the therapeutic promise? Her question is not foolish. It reflects how inadequately we have explained the disease. It is our failure. And it is very important to note that there is one change in the lens. Now we are seeing PCOS as a whole, PMOS, and this correcting the lens approach had actually been result of more than 14,000 surveys, including more than 10,000 patient survey and around 4,000 health professional survey. 56 organizations were being involved. So what is now important to note? The Polyendocrine Metabolic Ovarian Syndrome, beyond cyst, we need to think, and this is multi-system biology. This is high time we need to address this disease because 1 in 8 women are suffering from it. And our take-home message should be, when we change the name moves beyond the ovary. Our prescription must move beyond ovary. So what are we actually trying to improve? First of all, place the person, not the ovary or just a wing scale at the center. Metabolic health, insulin resistance, dysglycemia, cardiometabolic risk need to be improved. We need to address this endocrine reproductive health, hyperandrogenism, ovulatory dysfunction, menstrual health, movement and physical capacity, muscle function, physical activity, cardiorespiratory fitness, sleep and psychological health, the anxiety, depression, and body image, and most importantly, the outcomes like self-efficacy, shared goals, and how we can improve the quality of life. There are important clinical truths. Yes, insulin resistance is common, even in lean PMOS, but it is not universal. Adiposity may amplify severity, but it does not define PMOS. Movement provides benefits even without weight loss. And weight stigma harms well-being and engagement with the care. Again, we need to reiterate, we are not treating a number on the scale. We are improving health without diminishing the dignity. Coming to morning yoga. Morning yoga, yes, it is a cue, but not a cure. There is no evidence which suggests morning beats evening. So it is our judgment as per the patient preference. We need to choose the most sustainable time, because consistency matters more than timing. Never sacrifice sleep for exercise. Prioritize weekly movement dose. So it is not like that I have to do morning yoga. That is why I can't sleep more than 4 hours, 5 hours. So 6 to 8 hours sleep is essential. So the very important principle is Charaiveti, keep moving, continuity, not chronology that creates benefit. So continuity creates benefit. What the international guidelines actually recommends, choice is personalized, dose is explicit. Lifestyle intervention for every woman, that is the core care. Benefits occur even without weight loss. We need to personalize the route. No exercise modality proven superior. Choose the sustainable, preferred movement, move more, and sit less. This should be our principle. The dose 150 to 300 minutes of moderate intensity activity per week, or 75 to 150 minutes of vigorous activity per week. The very important to note, the strength training, the resistance exercise, at least two non-consecutive days per week. For greater benefit, modest weight loss or preventing the regain, 250 minutes or more moderate intensity activity, or 150 minutes of vigorous weekly activity is essential. Coming to yoga, yoga is a route into movement, not waver from an adequate activity dose. Yoga may be the doorway, but intensity must be assessed, and the remaining aerobic and strength dose should be completed. What does the yoga evidence show? Promising signal. This is the result from two systematic review meta-analysis. One is mostly the systematic review, the 2026 systematic review, and 2021 there was a systematic review meta-analysis. So actually they had shown some promising signal, but need to acknowledge the fragile evidence-based. What were the reported benefits? Menstrual irregulatory scores were improved. Insulin and HOMA-IR reduced, so insulin resistance reduced. Hyperinsulinemia was addressed. Hyperandrogenism scores improved. Stress, anxiety, quality of life improved. And there was certain selected hormonal metabolic changes ameliorating the condition. If you ask what were the quantitative signal from that meta-analysis, there was statistically significant benefit in terms of HOMA-IR reduction, but with pinch of salt, we need to consider this data, because two RCTs were pooled, low certainty evidence, and these were the surrogate outcome. So if we want to understand the evidence architecture, there were certain limitations. When we talk about 2023 study, it was including 11 studies and 515 participants, two RCTs entered meta-analysis, and then 2026, 9 reports, 6 independent data sets, and the participants per study, the number were not much. Single centers, 4 to 12 week study. No standardized yoga protocol were there. So there were higher risk of bias, and heterogeneity prevented updated pooling. Very importantly, we need to consider this when we talk about promising enough to offer as an adjunct, uncertain enough to overpromise. Whatever the observed change and what it does not automatically prove. So when we talk about lower HOMA, it just does not automatically prove it could prevent diabetes. Observed change was more frequent bleeding. So the delayed menstruation cycle that had been addressed, but actually it does not automatically prove confirmed ovulation. Lower testosterone, but we can say it restored the fertility. Change in AMH was noted, but again we can't just say that it rejuvenate the ovary function. Short-term weight change, short-term weight reduction were noted. We can't say it will translate it into long-term disease modification. Reduced anxiety score was noted, but we can say there will be a resolution of clinical depression. Evidence for pregnancy, live birth, diabetes prevention, and CV outcomes. These evidence are not sufficient. So when we talk about yoga, we need to acknowledge its source. From Vedas, we got Atharva Veda along with Upanishad. Generally, the Upanishad was dealing with this yogic philosophy. And from Atharva Veda, we got Ayurveda. Actually, the main function of this yoga was having a samatha. We know that Krishna told in Gita that yogastha kuru karmani sangam tattva dhananjaya siddho asiddho samobhutya samattang yoga uchyate. Samattang, equanimity. That is the primary target of yogic philosophy. For that, they need to take care of Panchabhut, how the Panchabhut and their relationship that may cause different type of disorders, doshas and gunas, and along with that, how we should advise our patient certain specific yoga. And when we talk about yoga, it is not only those asanas, but also we need to consider about ahara, the yogic diet, vichara, the behavioral and cognitive modification, and vihara, the lifestyle modification, which will include the physical activity, which will include the sleep. So this is a holistic thing when you talk about yogic philosophy. And very importantly, when you talk about yoga Vedic origin, it links Upanishad to yoga, yoking first the mind. The idea of yoga here is control of lower mind, much as in Yoga Sutras, and an awakening of the higher intelligence. So with yoga, always we believe it actually convert the illness into wellness. So the from conversion from illness to wellness, how it could be done if we convert the I to we. So multiple I means we. So just replace the word I to we, will get wellness. So that is the main objective of yoga, how I become we. Coming to molecular mechanism of yoga, there were a good number of studies which had clearly shown the immunometabolic disruption in type 2 diabetes can be addressed with yoga. Yoga can reduce the inflammatory cytokines, be it interleukin 6, TNF alpha, interleukin 1 beta. There will be reduction in CRP, and therefore there will be less cortisol, improving the insulin sensitivity. So ultimately, the metabolic inflammation which was causing insulin resistance, that can be targeted. We'll have less inflammation and balanced metabolic health. If we try to dissect different yoga's molecular mechanism, this is a very good review. How metformin works, we know. Similarly, how yoga works, how it improves insulin resistance, how it promotes the translocation of GLUT4 receptor, how it modulates that AKT pathway, how it acts on the insulin receptor substrate, the JAK-STAT pathway, even the nuclear receptor mediated modulation, and how it ultimately reduce the inflammatory cytokines, modulate the leptin level. That is quite interesting. Ultimately, what will happen? The hyperinsulinemia can be addressed, better glucose uptake will be there, so less insulin resistance, and our beta cell will be active to produce insulin. This was a very important systematic review done by Dr. Shashank sir and his team, which clearly tells us when we do yoga practice, we will have some behavioral change, psychological change, physiological change in terms of modulation in the sympatho-adrenal hypopituitary adrenal axis, hypothalamo-pituitary adrenal axis, and therefore when we talk about, we had shown that picture how the nuclear receptor, they act actually and change in the gene expression, cellular immunity, inflammatory response. Ultimately, the target is prevention and control of diabetes, control of body weight, BP, lipid profile, prevention of CV events, diabetic complication. So similarly, in this mechanism, yoga practice can help in PMOS. So yoga is not only exercise, it is more than that. When we talk about different component of yoga, the asanas, strength, flexibility, muscle glucose uptake, pranayama, help in autonomic balance, reduce the sympathetic tone, correct the parasympathetic dysautonomia. Dhyana and meditation actually reduce the stress, emotional regulation can be modified, relaxation techniques improve sleep, decrease cortisol and diabetes related distress, mindful awareness improve the eating behavior and adherence, discipline and routine are essential to have a sustainable lifestyle change. So yoga is not merely physical activity. It is movement with breath, with attention, with behavior training. So how might movement, especially yoga, can help in PMOS? There are acute responses like muscle contraction, GLUT4 translocation, insulin-independent glucose uptake, correcting the insulin resistance and hyperinsulinemia, so lower glucose insulin exposure that helps in improving metabolic capacity. Similarly, With chronic training, there will be a training adaptation. So improved insulin resistance, the mitochondrial level, the mitochondria can be addressed, dysfunction can be addressed, better mitochondrial capacity, increased cardiorespiratory fitness, preserved or increased muscle strength. The behavioral support, simple measures like move more, sit less, recover better, that cause smaller postprandial excursions of insulin and sugar, stress and sleep regulation, and greater self efficacy and adherence. So, all actually help in improving the metabolic capacity, and this benefit can occur without weight loss, so independent of weight loss. So, yoga may attenuate endocrine metabolic amplification, indirect and lower certainty pathways that had been shown. Like solid pathways means established physiology, dashed pathways are plausible or low certainty effect. But again, the take home message should be there are lots of WhatsApp university messages. Those messages need to be corrected. Those messages are on massage of ovaries. So no asana has been shown to massage the ovaries or dissolve the follicles or directly reset the reproductive hormone. So we should not spread this type of uh, non-evidence-based information. So prescribe yoga like a therapeutic intervention. Do not prescribe yoga, just write down yoga, finish. No, it is not our job. Prescribe a defined exposure, may take help from one yoga expert. Just like drug, there is specific indication. This is a chunk to comprehensive PMOS care, not replacement therapy. Formulation, here it is dynamic movement, strength, breathing, mindfulness. The dose FITTVP, that means the frequency, intensity, type, time, volume, and progression. This need to be mentioned. Start tolerably, progress on variable at a time. So titration need to be done. Co-design for preference, access, enjoyment level, and habit. That will improve the adherence. Screen different comorbidities, pregnancy, injury risk, medication effects, adherence, fitness, metabolic health, menstrual health, well-being. We need to monitor. So monitor health overall, not only just weight. And don't use any shaming word, blaming word. Combination therapy is essential. That means it is not only yoga, it is with yoga along with other lifestyle modification advices. Very importantly, you need to give emphasis on nutrition, sleep, quantity, quality, and chronobiology, the psychological care, and indicated medicines. A prescription without a dose, progression plan, or endpoint is just only advice. It is not a proper prescription. At the same time, we need to reiterate the concept from Katha Upanishad. We know our patient, we need to consider them, we need to educate them. They are the traveler. The self is the traveler. But at the same time, we need to take care of the chariot, the body, and how we can strengthen the charioteer. Who is the charioteer? Our intellect. And minds are the reins. To strengthen the mind, the intellect, the body, we need to have a proper yoga program. Because yes, knowledge is important. At the same time, the judgment, engagement, and sustained action. For that, we should have a proper control, over our mind. So with this intellect, the charioteer. So the most important part is information alone does not move the chariot. What do you want? The body, mind, judgment, and purpose must travel together. So ultimately, the chariot must move as one. Let's have 1 minute embodied reset. Just those who are listening, they can sit on the chair or just be stand up. This is the YouTube link. You just click on that YouTube link and do this exercise. This is 1 minute embodied reset, and stand comfortable. Seated participation is equally valid as of now. So Tarasan, we know this is a very famous tree in our country. Twara or Tala. The feet should be comfortably apart. Just have inhalation and make it upward. Just cross this upward and then again go down, exhalation with exhale. So 2 slow unforced breaths, inhale and arm rise, exhale, arm lower. So also you can do this 3 gentle chair squats, comfortable range, no breath holding please, then return to the posture. These are the simple 60-second, we can say, break the sitting. We know that sitting is a new smoking. There was one report. So with this type of 60-second exercise, we can have some break in the sitting. So we have not cured PMOS in 60 seconds, but we have interrupted sitting, which is very important, recruited our skeletal muscles to work, okay, like this. But this could also actually made our next prescription when we will write yoga in our patient memorable. So even you can do it in your clinic, because that will also help you interrupting your prolonged sitting. This is an evidence-informed 12-week yoga plus movement template. Arrive, first phase is arrive. Just be aware of your body. Have some diaphragmatic breathing, inhalation, slow inhalation and exhalation. The purpose is to make yourself ready. Then for 5 minutes, you can do this Tarasana. You can do cat-cow or joint mobility, some freehand exercises. Then the movement, the modified Surya Namaskar. We had done one study on modified supervised Surya Namaskar practice. Actually, that help in moderate activity of moderate activity of physical activity, moderate intensity physical activity. And apart from that, that also help us in getting the balance, autonomic balance. Next is the chair squat, some overbridge, wall or plank walk, because that will help in muscle recruitment. Then slow breathing, Nari Shodhana or Vramri type of yoga that helps in recovery. And very importantly, be settled at the last stage. Last phase is for 2 minutes, have some meditation or non-judgmental intention. So actually, the self-regulation can be restored with this type of meditation. So we can titrate the prescription just like your GLP-1 dose. Start slow, but move forward. Increase the minutes weekly. Past 2 weeks, it could be 3 days per week, and each time it could be 20 to 25 minutes, then increase it to 30 minutes, and finally reach the 40 to 45 minutes, and at least 5 days per week. Progress one variable at a time, frequency, duration, then effort or complexity of the exercises. These are a few important dose guardrails. During the active phase, you may have some talk test or the rate of perceived exertion. It should not be more than 6 out of 10. Give emphasis on strength exercise, at least 2 to 3 non-consecutive days per week. They should have strength exercise, add brisk walking or cycling or other preferred activities to reach that goal of 150 to 300 moderate intensity minutes of aerobic exercise. Protect sleep, individualize for fitness, pain, pregnancy, and comorbidities. So this is not a universally validated PMOS yoga protocol. Only activity performed at moderate intensity counts toward the moderate intensity targets. Then next, our work should be on measurement. Measure what matters after 12 weeks. We need to remember, measure the condition, but listen to the person, the lived experience, the experience on energy, sleep, daily function, mood, body image, PMOS, quality of life. So whether there is the depending on her priority, the predictable cycles, less fear, confidence in her body, better metabolic health, depending on that, you choose the outcome. Practice, then clinical health. That need to be measured. So success is clinical, behavioral, and personal. We need to give all emphasis with the clinical health, lived experience, and practice. So, yukta haro viharasya, yukta cheshtasya karmasu, yukta shapnam abhodasya, yoga bhavati dukkha. Those who are temperate in eating and recreation, balanced in work, and regulated in sleep, can mitigate all sorrows by practicing yoga. The Gita offers a philosophy of balance, not just one randomized control trial. Modern PMOS care similarly require integration, not a single intervention. So, our take-home message, yoga is valuable complementary pathway into sustainable movement, not a cure for PMOS. Prescribe it with defined dose, gradual titration, safety assessment, and outcome monitoring. Combined metabolic science with menstrual, psychological, and spiritual well-being without replacing the necessary medical care. So, thank you. We need to take this message. Yoga does not treat an ultrasound image. It can help a woman, a mother, reclaim movement, metabolic agency, and inner steadiness. We have evidence-based medicine that is going to definitely protect her future. So thank you very much. If we have some question or comment, we can address those. Thank you.